Welcome to Nurses Lab. This section explores the essential steps required for effective preparation for nursing licensure examinations, including the NCLEX and Prometric exams. These examinations are crucial for obtaining a practice license as a registered nurse in various Western countries through the NCLEX RN examination and the Pearson VUE Prometric examination in Middle Eastern countries. In this discussion, particular emphasis will be placed on the quiz-type examination methodology as it pertains to the digestive system. This approach is designed to help candidates build confidence and competence in tackling digestive system questions commonly encountered in licensure exams. Now, let's start with our questions. Question number 1. A 48-year-old client with a history of peptic ulcer disease reports sudden, severe abdominal pain and rigid abdomen. What is the nurse's priority action? Option A, notify the healthcare provider immediately. Option B, administer prescribed antacid. Option C, encourage oral fluids. Option D, provide reassurance to the client. Correct answer is option A. Now let's see its explanation or rationale. Explanation for option A is rigid abdomen and severe pain suggest perforation. Immediate provider notification is priority. Explanation for option B is antacids do not treat perforation. Explanation for option C is oral fluids contraindicated with suspected perforation. Explanation for option D is reassurance is supportive but not priority. Question number 2. A client with cirrhosis is prescribed lactulose. Which outcome indicates the medication is effective? Option A, decreased ascites. Option B, reduced ammonia levels. Option C, increased urine output. Option D, improved appetite. Correct answer is option B. Now let's see its explanation or rationale. Explanation for option B is lactulose reduces ammonia by promoting excretion in stool. Explanation for option A is ascites is managed with diuretics. Explanation for option C is urine output is unrelated. Explanation for option D is appetite is not directly affected. Question number 3. A client with hepatitis B is hospitalized. Which infection control measures should the nurse implement? Option A, use standard precautions. Option B, wear gloves when handling blood or body fluids. Option C, place client in airborne isolation. Option D, dispose of sharps in puncture-resistant container. Option E, restrict visitors completely. Correct answers are options A, B, D. Now let's see its explanation or rationale in correct order. Option A, standard precautions are required. Option B, gloves prevent transmission. Option D, sharps disposal prevents exposure. Option C, hepatitis B is bloodborne, not airborne. Option E, visitors are allowed with precautions. Question number 4. A client recovering from abdominal surgery reports nausea. Which intervention should the nurse implement first? Option A, offer clear fluids. Option B, administer prescribed antiemetic. Option C, encourage ambulation. Option D, provide oral hygiene. Correct answer is option B. Now let's see its explanation or rationale. Explanation for option B is antiemetic relieves nausea and prevents vomiting. Explanation for option A is fluids may worsen nausea. Explanation for option C is ambulation does not relieve nausea. Explanation for option D is oral hygiene is supportive but not priority. Question number 5. A nurse is preparing to insert a nasogastric tube. Place the steps in correct order. Option A, perform hand hygiene and don gloves. Option B, lubricate tube tip. Option C, insert tube while client flexes neck. Option D, measure tube length from nose to ear to xiphoid. Option E, verify placement by aspirating gastric contents. Correct order is A, D, B, C, E. Now let's see its explanation or rationale in correct order. Option A, hygiene first. Option D, measurement ensures correct length. Option B, lubrication eases insertion. Option C, flexed neck reduces risk of aspiration. Option E, verification confirms placement. Question number 6. A newly diagnosed client with Crohn's disease says, "I'm worried I'll never live normally again." What is the nurse's best response? Option A, "Don't worry, you'll be fine." Option B, "Tell me more about your concerns and what living normally means to you." Option C, "You should focus on staying positive." Option D, "I'll ask the provider to prescribe medication for anxiety." Correct answer is option B. Now let's see its explanation or rationale. Explanation for option B is encourages therapeutic communication. Explanation for option A is false reassurance. Explanation for option C is minimizes feelings. Explanation for option D is medication may help but does not address emotional need. Question number 7. A client with acute pancreatitis reports severe epigastric pain radiating to the back. Which intervention is priority? Option A, administer prescribed IV opioids. Option B, encourage oral fluids. Option C, provide high-fat diet. Option D, position client supine. Correct answer is option A. Now let's see its explanation or rationale. Explanation for option A is pain relief is priority in pancreatitis. Explanation for option B is oral intake is restricted. Explanation for option C is high-fat diet worsens condition. Explanation for option D is supine position increases discomfort. Question number 8. A nurse is teaching a client about colorectal screening. Which statement indicates correct understanding? Option A, I should begin screening at age 45. Option B, screening is unnecessary if I feel healthy. Option C, a chest X-ray is the best screening tool. Option D, I only need screening once in my lifetime. Correct answer is option A. Now let's see its explanation or rationale. Explanation for option A is screening begins at age 45 for average risk adults. Explanation for option B is screening is preventative, not symptom-based. Explanation for option C is chest X-ray is unrelated. Explanation for option D is screening is repeated at intervals. Question number 9. A nurse is delegating tasks to a UAP for a client with gastroenteritis. Which task is appropriate? Option A, administer oral rehydration solution. Option B, report frequency and character of stools. Option C, initiate IV fluids. Option D, provide dietary teaching. Correct answer is option B. Now let's see its explanation or rationale. Explanation for option B is UAP can report observations. Explanation for option A is oral rehydration requires RN. Explanation for option C is IV fluids require RN. Explanation for option D is teaching requires RN. Question number 10. A 65-year-old client with cirrhosis develops confusion and asterixis, or flapping tremor. What is the nurse's priority action? Option A, administer prescribed lactulose. Option B, provide high-protein diet. Option C, encourage oral fluids. Option D, place client supine. Correct answer is option A. Now let's see its explanation or rationale. Explanation for option A is lactulose reduces ammonia by promoting excretion in stool. Explanation for option B is high protein worsens ammonia. Explanation for option C is fluids do not address cause. Explanation for option D is supine position does not improve condition. Question number 11. A client with a history of diverticulitis reports left lower quadrant pain, fever, and nausea. Which intervention is priority? Option A. Administer prescribed IV antibiotics. Option B. Encourage high-fiber diet. Option C. Provide oral fluids. Option D. Ambulate client frequently. Correct answer is option A. Now let's see its explanation or rationale. Explanation for option A is IV antibiotics treat infection. Explanation for option B is high-fiber diet avoided during acute phase. Explanation for option C is oral fluids may worsen symptoms. Explanation for option D is ambulation does not address infection. Question number 12. A client with GERD is prescribed omeprazole. Which teaching is most important? Option A. Take this medication before meals. Option B. Stop taking the medication if symptoms improve. Option C. Take with antacids for best effect. Option D. Avoid reporting side effects unless severe. Correct answer is option A. Now let's see its explanation or rationale. Explanation for option A is proton pump inhibitors are most effective before meals. Explanation for option B is therapy should continue as prescribed. Explanation for option C is antacids not required with PPIs. Explanation for option D is side effects should always be reported. Question number 13. A client with Clostridium difficile infection is admitted. Which precautions should the nurse implement? Option A. Contact precautions with gown and gloves. Option B. Hand hygiene with soap and water. Option C. Use alcohol-based sanitizer only. Option D. Place client in private room. Option E. Dispose of contaminated linens in biohazard bags. Correct answers are A, B, D, and E. Now let's see its explanation or rationale. Explanation for option A is contact precautions prevent spread. Explanation for option B is soap and water required, spores resist alcohol. Explanation for option D is private room reduces transmission. Explanation for option E is dispose of contaminated linens safely. Explanation for option C is sanitizer alone ineffective. Question number 14. A client with a colostomy reports skin irritation around the stoma. What is the nurse's best intervention? Option A. Apply skin barrier before attaching pouch. Option B. Use alcohol to clean skin. Option C. Encourage tight pouch seal with tape. Option D. Restrict fluid intake. Correct answer is option A. Now let's see its explanation or rationale. Explanation for option A is skin barrier protects peristomal skin. Explanation for option B is alcohol irritates skin. Explanation for option C is tight seal may worsen irritation. Explanation for option D is fluids should not be restricted. Question number 15. A nurse is preparing to administer enteral feeding via NG tube. Place steps in correct order. Option A. Check residual volume. Option B. Flush tube with water. Option C. Verify tube placement. Option D. Administer feeding. Option E. Flush tube after feeding to maintain patency. Correct order is C, A, B, D, E. Now let's see its explanation in correct order. Option C. Placement verified first. Option A. Residual checked to prevent aspiration. Option B, tube flushed before feeding. Option D, feeding administered. Option E, tube flushed after feeding to maintain patency. Question number 16. A client newly diagnosed with ulcerative colitis says, "I'm afraid I'll never be able to eat normally again." What is the nurse's best response? Option A, "Don't worry, you'll be fine." Option B, "Tell me more about your concerns regarding diet." Option C, "You should avoid thinking negatively." Option D, "I'll ask the provider to prescribe medication for anxiety." Correct answer is option B. Now let's see its explanation or rationale. Explanation for option B is encourages therapeutic communication. Option A, false reassurance. Option C, minimizes feelings. Option D, medication may help but does not address emotional need. Question number 17. A client with acute cholecystitis reports right upper quadrant pain radiating to the shoulder. Which intervention is priority? Option A, administer prescribed analgesics. Option B, encourage high-fat diet. Option C, provide oral fluids. Option D, position client supine. The correct answer is option A. Now let's see its explanation or rationale. Explanation for option A is pain relief is priority. Explanation for option B is high-fat diet worsens symptoms. Explanation for option C is oral fluids may be restricted. Explanation for option D is supine position increases discomfort. Question number 18. A nurse is teaching a client about preventing hepatitis A. Which statement indicates correct understanding? Option A, "I should wash my hands before eating." Option B, "I can share utensils with family safely." Option C, "I should avoid vaccination if I travel." Option D, "I only need precautions if I feel sick." Correct answer is option A. Now let's see its explanation or rationale. Explanation for option A is hand washing prevents fecal-oral transmission. Explanation for option B is sharing utensils spreads infection. Explanation for option C is vaccination recommended for travelers. Explanation for option D is precautions needed even if asymptomatic. Question number 19. A nurse is delegating tasks to a UAP for a client with gastroesophageal reflux disease, GERD. Which task is appropriate? Option A, teach clients about dietary modifications. Option B, report frequency of clients belching. Option C, administer antacid medication. Option D, adjust head of bed to semi-Fowler's position. Correct answer is option B. Now let's see its explanation or rationale. Explanation for option B is UAP can report observations. Option A, teaching requires RN. Option C, medication administration requires RN. Option D, positioning for therapeutic purpose requires RN judgment. Question number 20. A 70-year-old client with esophageal varices develops hematemesis and hypotension. What is the nurse's priority action? Option A, administer prescribed IV fluids. Option B, provide oral fluids. Option C, encourage ambulation. Option D, document findings. Correct answer is option A. Now let's see its explanation or rationale. Explanation for option A is IV fluids stabilize circulation in acute bleeding. Explanation for option B is oral fluid contraindicated. Explanation for option C is ambulation unsafe. Explanation for option D is Documentation occurs after stabilization. Thank you for engaging with this section on nursing licensure examination preparation. We appreciate your dedication to advancing your knowledge and skills and hope that this discussion on the quiz-type examination questions for NCLEX RN and Prometric in Digestive System has provided you valuable insights. Wishing you the very best in your studies and future nursing career. See you soon in our next video.